My name is Dr. Tom McCarrick. I'm the Chief Medical Officer at Vanguard Medical Group. I'm a primary care physician, family medicine, been practicing for 38 years in northern New Jersey. We have 10 offices, about 55 providers, take care of about 70,000 patients. We signed up with Lightbeam, and it turned out to be really lucky for us that we chose a really good platform that was growing the same time we were. Now we have a small clinically integrated network with 4 other practices. So even at this point, Lightbeam is now supporting that larger group of practices and these larger contracts. The Lightbeam platform is really it's a necessary foundational technology in any kind of large value-based contracting. You can't be in value-based contracting and not have access to the data, not have analytics, not just the technology, but the people who can support value-based contracting. So Lightbeam turned out to be, the right application for us at the right time. And then as Lightbeam has grown and has evolved and has added new capabilities and features, we have simultaneously been trying to use those things, and we've been developing our own population health staff to take advantage of those things. So it's been kind of a mutual evolution. In our area, we have these high professional costs, we have significant out-of-network, and we needed to have some discipline across all these practices. We had 10 offices, but each office had their own little list of favorite specialists. Those lists were just based on relationships. There was no data to support them. There was no vetting to figure out whether they were in network or out of network. So we started with that, and we implemented a process to clean up those lists, to vet those practices. And now we have a pretty robust, we call it our medical neighborhood program. We have a medical neighborhood coordinator, but Referral Point is kind of the core of that, because we use the data from Referral Point, and we use the workflow process at the point of care to manage the referrals. And with that, we've been able to drive our out-of-network referrals down to about 5%, which is fantastic. I think Lightbeam is helping us in a lot of ways. I mean, our whole care coordination process is really based on using Lightbeam to identify the patients, for risk stratification. Our director of care coordination manages the number of patients that each care coordinator is following and assigns them based on their complexity. So that whole process is really based on Lightbeam. It would be very difficult to run that. We'd be running that off of spreadsheets, like Excel sheets, without Lightbeam, and it would never be really up to date. It would be much more difficult to manage. So we are trying to drive population health down now to not just individual providers, but to teams of providers. So we're using Lightbeam data to do that. Risk adjustment coding, that's completely dependent on Lightbeam up to this point, although we are seeing that our EHR is now starting to add enhancements to help do that as well. So I think we've had success with Lightbeam on a number of fronts.